Hello, welcome to Being Patient Live Talks. Today we have a special guest that is going to help answer the question, is hearing loss connected to cognitive decline? Kimberly Mueller is an associate professor in the Department of Communication Sciences and Disorders at the University of Wisconsin-Madison, my alma mater too, so go Badgers. Her work also focuses on speech and language change in preclinical Alzheimer's, mild cognitive impairment, and dementia, and utilizes high-tech methods to aid in their investigations. Kimberly, thank you for joining us.
Thank you so much for having me.
First of all, give us an idea of how extensive hearing loss is among seniors today.
Yes, so I think I want to make the distinction. Age-related hearing loss is something that happens to older adults, and it happens to most older adults. And 1 in 3 seniors over the age of 65 is going to have some kind of hearing loss. And as they get older, the numbers increase. Right now, there's about 72 million people in the US who are living with some kind of hearing loss. So it's a very prevalent part of aging. It's actually part of typical aging. That's how we view it. But it's a treatable part of aging, and there's a lot of reasons to look into treatment for hearing loss.
And what do we know right now about the relationship between hearing loss and changes in memory and thinking?
Right. So a lot of studies have been done looking at longitudinal risk of developing dementia in people who have hearing loss versus people who don't. And people who have untreated hearing loss have a much larger risk of getting dementia relatively to the general population. So, hearing loss is considered to be one of the top modifiable risk factors for dementia, meaning that it's something that you can do something about to potentially lower your risk of dementia. So we know that there's this relationship that exists between hearing loss and increased risk of dementia. The reasons why that exists are not fully understood, but one potentially very strong factor is that if you are having hearing loss, you're in an environment maybe where that's noisy, or you're out to dinner at a restaurant and you're working really hard to hear the person who's in front of you, as well as tune out what's behind you. And so that kind of effort into listening can detract from all your other memory and thinking skills that you need to use on a day-to-day basis. And so we think that there's that interference that's happening. That's one potential reason. But then also you can imagine that that becomes very frustrating as hearing loss worsens. And so many people tend to withdraw from those kinds of environments. And then we see this kind of reduction in social contact and an increase in isolation. And those are factors that are related to dementia. So I think it's a multifactorial bi-directional process that we don't fully understand, but there are some key aspects that we think are really playing a role.
And you actually conducted a clinical trial or a study on this. Tell us how that works, and how long has it been going on, and who did you get to participate in this?
Yeah, so I think the subject of the clinical trial is really important, and it actually relates to the entire issue of getting your hearing treated. So, hearing aids are one potential treatment for hearing loss. And not everyone is eligible, but many people, older adults who have age-related hearing loss, are eligible for hearing aids. And this can dramatically improve quality of life. We know that. There have also been studies to show that hearing aid users do have a lower risk of dementia compared to people with hearing loss and no hearing aids. So we know that there's that factor. We also know that in our society, there's an access problem. And so not everyone who has a hearing loss has access to go to the doctor and get an audiology referral and then go to an audiologist, get hearing test, pay for hearing aids. It's a lot of steps to get the appropriate hearing care. And so the FDA a couple of years ago approved over-the-counter hearing aids. And these are hearing aids that you don't need a prescription for. You can order them online. You can get them at big box stores. And it's you can think of it like going to Walgreens or to the pharmacy to get readers, like reading classes. You know, you don't need a prescription. You try them on, you kind of have an idea, and it makes your reading better, and you don't have to go through all of the medical care. Same thing with these over-the-counter hearing aids. They're appropriate for a certain type of hearing loss, mild to moderate hearing loss, and so forth. But these over-the-counter hearing aids have not been tested in people with mild cognitive impairment or the precursor to dementia. And so that is our clinical trial, is to see if people go to the doctor for memory concerns, they get a diagnosis of mild cognitive impairment or early stage dementia, and they also find out that they might have a hearing loss and they have to then go to another doctor and get an audiology appointment and so forth. Our idea is, can we intervene at that point with over-the-counter hearing aids so that that person is sort of dealing with one diagnosis, mild cognitive impairment, and getting treatment at the same time with kind of a simple solution, these over-the-counter hearing aids. And so our trial is still going on. It's a collaboration with Dr. Pam Souza at Northwestern University and here at UW-Madison. And we have been recruiting people in that situation, people who go to the doctor and are there to get a potential diagnosis of dementia or mild cognitive impairment. And we're there recruiting them to see if they want to sign up for this over-the-counter hearing aid clinical trial. And so I think, you know, we're kind of nearing the end. We're still looking for about 10 or 15 more people to be in the trial.
How
But
many people have been in it so far?
we're up to somewhere between 25 and 30. I don't have the exact number on me, but our goal was to have 40 people for this trial. And I think one of the really encouraging findings is that the interest was really overwhelming. So many of the patients who were coming for that other reason were interested in enrolling in the trial. They might not have met eligibility. We had kind of strict eligibility criteria, but the interest was really strong. And then of the people that have enrolled, the compliance and the use of these over-the-counter hearing aids has been also extremely strong. And so I think that's, you know, probably the most that I can say at this point. But what we're measuring is, number one, do people feel with mild cognitive impairment, are they able to benefit from these over-the-counter hearing aids? And number two, we're looking at an actual objective conversation measure. So we have them come in, they sit sort of behind a barrier, and their care partner or spouse or friend is on the other side of this barrier, and they have a task they have to communicate with each other. And so we're looking to see how well they're doing that after having worn these over-the-counter hearing aids. So it's kind of got a dual outcome. You know, first, quality of life, improvement in everyday hearing, and then actual relationship improvement in conversation.
So I know you're about to or close to kind of going through all the information and having results, but anything else you can say on a preliminary finding or just a general feeling from what you've seen in these testing?
Well, you know, as a scientist, I don't want to say I have a feeling, but I think, you know, just based on other literature about hearing aids and about over-the-counter hearing aids, And based on the compliance and based on all of these factors, I feel very positive about the results of this trial and that we will be able to take this much larger in the future. And that's our plan, is to kind of move this towards an implementation model where we can actually implement this kind of work in different memory clinic settings. And that's the kind of way we want to go. So I have a good feeling, and I hope that we have our results out soon. We'll probably be presenting some of that at the Alzheimer's Association conference next summer if we're fortunate.
Okay. Many people think of hearing loss as just a sensory issue. You've kind of talked, a brief mention about this, but how do you think hearing loss also becomes sort of a cognitive and social, emotional issue for people and their families?
Yeah, yeah. I think that it can put a strain on relationships in general. So if your partner is having trouble hearing, that can be very frustrating for you, and then it can be frustrating for the person with hearing loss. And so there's this strain on relationships, but then, as I mentioned earlier, there's this cognitive load, is what they refer to it as, where you're putting a lot of your thinking resources toward hearing what's being said and making sense of what's being said so that it's hard to remember things, and so sometimes hearing loss can mask as cognitive decline. And when someone actually gets these hearing aids, then you can see an improvement in some cases. So, there's that piece of it. There's also this theory that maybe with some of these diseases like Alzheimer's disease, vascular disease, maybe there's shared pathology, meaning that maybe some of the neurodegeneration that happens as a result of those diseases is also happening in the auditory cortex part of the brain. And so that could be a potential role. But then also we know, like based on neuroplasticity principles, that if you're not using some part of your brain for a period of time, you're losing it. So use it or lose it. And if it's becoming more and more difficult to hear things and you're losing that sensory input that you once had, there may be some brain shrinkage in that region, and that can also cause cognitive decline. So I think there's, a lot of factors at play. The other thing you mentioned is social relationships, loneliness and isolation are such a part of hearing loss and then a risk for dementia. And so, if we can improve hearing and then have a downstream effect on social relationships, more uh, taking part in different activities, then, that's going to have better outcomes for people.
And give some advice to our audience here. What some early signs, either in hearing or in communication, that might sort of signal that it's time to get a hearing evaluation?
Yes, so some signs would be probably one of the number one signs is that your partner might tell you, I think you're not hearing me, or you might feel like others are mumbling a lot of the time. And in fact, maybe they're not, and maybe that's hearing loss. You might see that the TV needs to be louder and louder in order for you to hear it, or that you're in a restaurant and you're just having more and more trouble hearing the person next to you. And so those are some signs. There's also no reason, once you hit the age of 50, 60, there's no reason you can't get an audiological evaluation unless if you don't have health insurance, that's a big reason. But if you have access, getting a hearing test kind of on the younger side can give you this nice baseline so that when you do potentially start noticing things, you can compare it to this baseline. So seeing an audiologist, getting a hearing test, if you're eligible and you're able to pay for that and have access to that, that would be the best thing to do. If you don't have access, then I would say looking into um, different resources such as over-the-counter hearing aids. Aging and disability resource centers may be able to help you find affordable hearing aids. So there are lots of options that may increase accessibility.
There's also, a lot of advances in technology. I think, iPhones and things like that, using those as hearing aids. What's your opinion on using sort of the earbuds, and are those things on par with the traditional hearing aid?
I think that not with a traditional hearing aid. So the traditional hearing aid, you're in a sound booth with an audiologist, and they are fine-tuning every frequency to your particular hearing loss. And so we're talking about like 8 different frequencies or pitches. And they're really fine-tuning this and working with you to find the perfect situation. So that is not on par with the kinds of earbud technology. That being said, I think that that kind of technology is super exciting. It's more on par with what we're talking about when we say over-the-counter hearing aids. And if it helps you and you have access to it, go for it. I think that the technology, just even for regular hearing aids, is incredible. They're very invisible compared to how they used to be. And you can use your phone to lower the volume, raise the volume, block out background noise. So there's so much that can be done, and these big tech companies are developing things more and more, so it's really exciting.
Yeah, I'm wondering, it's kind of like when people cameras, people said that there's no way that that an iPhone will be able to do what a, SLR does, but lo and behold, they're, erasing things from the picture and using algorithms to calculate fill in background. So could be early
Exactly
days
right.
for what this technology can do, right?
That's exactly right. And it's always good for us to be open.
And at the same time, speaking of technology, you're involved in other areas which are fascinating. Your lab uses naturalistic digital speech recordings, natural language processing, and machine learning to identify sort of linguistic and acoustic markers of cognitive decline. Put that into simple English as to what you're doing there and what you're finding.
Yeah, definitely. So, University of Wisconsin-Madison has a big Alzheimer's disease research center, and we have a longitudinal study called Wisconsin Registry for Alzheimer's Prevention, and it's been going on since 2000. So, we've been following people who are healthy when they start, but they had a family history, a parent who had Alzheimer's disease, and so we've been following them upwards of 20 years in some cases. And one of the key aspects of this Alzheimer's Center is that we have biomarkers, and we're focused here on early detection of Alzheimer's disease and related dementias. So biomarkers including PET scans and blood biomarkers of the proteins that constitute Alzheimer's disease. And so at the same time, I'm a speech and language pathologist. And so I've been collecting digital recordings. So just using, in the beginning, we just had a little audio recorder. Now we use an iPad, but of people talking like I'm doing now, just talking off the top of your head, describing a picture, answering a couple questions. And so we have thousands of these recordings over time. And we have these brain biomarkers of the disease in people who aren't yet showing overt symptoms. And so, what we're doing is taking these speech samples and analyzing them in a way that wouldn't be detectable just by listening, but we're noticing subtle changes to speech over time in these individuals, particularly those who have the Alzheimer's disease biomarkers in their brain. And so it's exciting because speaking is a functional activity. It's something we do every day. The cognitive testing that we do here is very extensive. It takes 2.5 hours. It takes a lot of training to be able to administer those tests. And so ideally, one day, what we're thinking is that this kind of speech test could be an ideal maybe screener for people who are more at risk for cognitive decline, or a screener for people who might want to be in a clinical trial. Also, it could serve as a good outcome measure for clinical trials. And that's one reason we're using it in our hearing aid trial as a clinical outcome measure.
Yeah, we've interviewed other companies before, sort of with apps along that line, trying to measure that, where are we sort of in this field of being able to somebody give a voice sample and then sort of get a reading of um, your health and, recommendations that need to be looked out, where are we in this sort of use of technology?
Yeah, I think, it depends on who you ask. I think the companies would kind of have a different opinion than what I have. But the way that I see it is that speech and language change, longitudinal change, is going to be a reliable measure of cognitive decline. But I don't think that we are at the point at all of having one speech sample and then getting this snapshot of someone's health, whether or not they have depression, disease, Alzheimer's, all of that, just based on voice from one time point. I don't think that that is realistic. We all have such different ways of speaking, and so we really need within person longitudinal change. And so there haven't been enough of those kinds of studies yet. And that's what we're trying to contribute here.
And regarding your hearing aid study, have you seen specific cases whereby it was just a dramatic change in, or somebody that was almost reluctant to use it, and it made a dramatic change in their ability to communicate very
Uh,
quickly?
I, again, I haven't looked at the data yet, and that's a good question. I think by and large, that kind of dramatic response to a hearing aid is not typical, honestly. It's not a typical response because it's like getting I don't know if you know anything about like getting progressive glasses, where it's
Yes, yes.
cool technology, right? But when you first get it, it's your brain has to get used to it and it's not fun. And then you get used to it and you're like, how did I ever live without it? And so it's the same idea with a hearing aid. Your brain really has to retrain itself because all of a sudden now you have this hearing aid and you're hearing things that you didn't know you could hear, like footsteps and rustling papers and things like that. So now you're kind of on an overload for a little while. So I don't think that I'm ever gonna, I don't know, maybe we will see someone it was life changing for them, but I think that's more of a gradual change.
Okay, we've got a question from a viewer. It says from Namisha, great talk. What type of communication strategies in general would you like to recommend for individuals with hearing loss and cognitive decline?
Thank you so much. That's such a great question. So, in general, uh, hearing aids are not the only treatment. There's also communication strategies, right? And so, strategies include speaking to the person with hearing loss more clearly, but not louder. It's our instinct to shout, but it's really about these consonants and the clarity of speech than it is about volume of your overall language. So that would be one thing. Another thing is kind of obvious, but you don't think of it in the moment. Face-to-face contact instead of side by side or behind someone, getting right face to face. Anytime visual supports can be used, especially with someone who also has cognitive impairment, using kind of visual cues about what's coming next. Those kinds of things are also really helpful. But I would say, face to face, improving clarity of speech, maybe slowing speech down a little bit, are great strategies. And then I just want to mention the stigma that comes with hearing loss. And I think that ultimately that stigma is more related to aging stigma and ageism than it is to hearing impairment per se. And so a lot of people are reluctant to get their hearing tested because of the stigma. And anything we can do to reduce that stigma, I think is going to just improve public health overall. And so, I don't know exactly how other than, shows like this where we talk about it and it's like any other health issue. It's something that we can get treated and we should get it treated so that we can live the best life that we can.
Okay. I had a question that I forgot to ask regarding the speech and speech patterns. Can everyday speech patterns, reveal changes earlier than the sort of standard memory test?
I think that we have seen that. So we've compared some of our speech measures, and some of the most sensitive ones have to do with timing of speaking. And so what's happening when you're speaking is you're relying on pretty much every cognitive process you have. You have to rely on memory, you have to rely on short-term memory, executive function, planning. All of this is happening all at once. And so we have compared some of our timing measures to the regular neuropsychological tests that have been used. And we are seeing in some cases that these measures are more sensitive to pathology in the brain or potentially to a diagnosis or predicting a future diagnosis. So I think that it has a ton of promise because it's such a complex activity that we actually don't have to think a lot about, but it is pretty complex.
And finally, I wanted to ask you, do you believe there's enough of a effort or campaign to sort of integrate hearing care into public health strategies?
I think that no. I think that there needs to be more in terms of public health, payment for hearing aids. Um, Medicare is still not a payer of hearing aids. Other kinds of insurance can cover some of it. So there's still a long way to go in terms of improving access for everyone. And then I think, as I mentioned, reducing the stigma is another piece that public health needs to catch up on. And I think the connection between dementia and hearing loss is becoming more and more known. And so that's going to improve policy in the long run as well. But I do think we still have a way to go to kind of increase awareness, reduce the stigma, and get better access for everyone.
That's all we have time for today. Kimberly, thank you so much for sharing your fascinating work with us, and please keep us posted on your findings in the future. We'll be very interested to see those. To our viewers, thanks for tuning in, and please be sure to sign up for our newsletter at beingpatient.com, where we'll keep you informed of all of our upcoming talks. See you next time.
Thank you.